Welcome back, dear viewers. Today's discussion is not just informative, but life-saving. We'll uncover why even fit and healthy-looking youngsters are at risk of heart attacks. So the topic is, why more healthy-looking young people are dying of heart attacks. Silent heart crisis, young Americans and the hidden threat. In America's cities, mornings always look full of energy. Joggers fill Central Park, engineers in Silicon Valley bend over their laptops, college students laugh in cafeterias, and athletes push themselves in stadiums. From the outside, everything looks healthy and perfect. But inside, a silent storm is brewing, one that is quietly weakening their hearts. Every 34 seconds, one American dies of cardiovascular disease, and shockingly, these deaths are increasingly striking the young. According to CDC data, between 2011 and 2022, heart attack deaths among adults aged 18 to 54 rose by 57%. 1 in 5 heart attacks now occurs in people under 40. Take the story of a 29-year-old software engineer in San Francisco. He collapsed during a Zoom call, and the autopsy revealed severe coronary artery blockages that had never been diagnosed. Or the 35-year-old mother in Texas who fell unconscious while shopping, only to learn her heart had been silently damaged for years. These are not just statistics. They are real lives cut short. Sometimes the danger is hidden in DNA. Hypertrophic cardiomyopathy, a condition where the heart muscle thickens abnormally, is the leading cause of sudden death in young athletes. Long QT syndrome, an electrical rhythm disorder, can stop the heart in an instant. Familial hypercholesterolemia drives cholesterol so high from childhood that arteries clog early in life. As a Johns Hopkins geneticist explains, these conditions often remain invisible. A young person may feel fine until one stressful moment triggers a fatal arrhythmia. But genes are only part of the story. The modern American lifestyle is accelerating heart damage. Obesity has reached epidemic levels, with 41% of young adults classified as obese. Sedentary office culture, binge-watching, gaming, and fast food diets are common. Stress from student loans, job insecurity, and digital overload adds fuel to the fire. A Harvard expert warns, stress hormones like cortisol damage arteries over time. Even people who look fit can be poisoned by poor sleep and chronic stress. Consider the 34-year-old Wall Street banker who worked 80 hours a week. One day, he suffered a massive heart attack at his desk. His story is a warning that the American dream can sometimes become a nightmare for the heart. Even athletes are not safe. Stadiums have witnessed basketball players and football stars collapsing mid-game. Despite their fitness, hidden plaque buildup or genetic predispositions make them vulnerable. The American College of Cardiology cautions, fitness is not immunity. Muscles may be strong, but arteries can still be weak. Then came COVID. The pandemic scarred not only lungs, but hearts. Research shows survivors face double the risk of heart attack and stroke for years after infection. CDC researchers note, lingering inflammation and clotting disorders are common in young adults post-COVID. It's a hidden risk many don't realize. The virus may be gone, but its shadow remains. The most tragic part is that the body whispers before it screams. Chest pain, dizziness, fatigue. These are signals, but young people often ignore them. One young woman dismissed her chest tightness as stress, only to discover later that her arteries were blocked. Doctors warn, the heart speaks softly at first. If ignored one day, it will shout by stopping. The solution lies in awareness and prevention. ECGs, cholesterol checks, and genetic screenings are vital. Lifestyle changes, balanced diet, regular exercise, stress management. Protect the heart. CPR and defibrillator training can save lives in emergencies. The American Heart Association reminds us, every 40 seconds, someone in the US has a heart attack. Immediate action can mean survival. Heart health is not about age or appearance. It's about awareness, prevention, and listening to your body. The silent crisis can be stopped if we act now. Know the signs, get screened, save lives. Friends, remember, your health is your greatest wealth. Stay aware, stay active, and take care of your heart. Thank you for watching.